Hey guys, today I'm going to talk about med administration. We're also going to talk about orders and your MAR, and once you receive orders, what you do with them, and also how to transcribe them onto your MAR. So on Blackboard, you should have 3 different patients with orders that you've received and with a current MAR. So you need to make sure you print those off and bring all 3 of those with you to your checkoff. You do not know which patient you're going to get, so you need to have all 3 of them ready. So I have printed one of them off, so I have an order set here. And I also have a MAR, okay? All right, so on the orders, you've received new orders. So you come on shift, you receive new orders. My orders are admit to a med surg unit, vital signs Q shift, Lasix 20 milligrams PO daily, Lipitor 10 milligrams PO daily, change Restoril to 15 milligrams PO daily at HS, and then K-Dur 20 milliequivalents PO BID. All right, so these are new orders. So I need to make sure I note these orders, okay? So in facilities, you're going to have a little button that says acknowledge. It means that you've seen the orders and you're aware of them and you're carrying them out. Okay, on paper, we used to note our orders. So we're teaching you this because we don't have an electronic health record and we're not using electronic charting. So we're going to teach you to do it on paper, which you may have to do during your practice if you have like a power outage or a hurricane or something and your computer system goes down. It just recently happened at one of the facilities and they had to go to paper. All right, so the first thing you're gonna do is I'm gonna go ahead and do it. You're gonna note your order. So I'm gonna do it and then I'll hold it up and show you. And the dates aren't right on here. So just disregard that. Okay, so right here we have our order and I have bracketed it and I wrote noted, the time, and the date. So the time I noted it was about 10 minutes after I received it. You want to make sure that, you know, if you got orders, you need to note them in an appropriate time frame. And then my signature with my initials and my credentials, excuse me. So this is very important. This says I saw it and I'm carrying this out. Okay, so now that I've done this, now I need to make sure and transcribe this onto my MAR, okay? So the first thing I wanna do is we're gonna change a medication. We're gonna change our Restoril. Currently it's at 7.5 milligrams and we're changing it to 15 milligrams. So I'm gonna put a big line through it and I'm gonna write D-Seed, and I'm gonna take a highlighter, I like yellow, and I'm gonna highlight that entire line that says that we are no longer giving this medication. Okay, so this is what it looks like. It's big and bold and it says we are not giving this anymore. All right, so the next thing I'm gonna do is I'm going to write what date our order was given. So it was given today, and I'm gonna use the date that my order has, and what time. It was at 8 o'clock, and that we're giving Restoril 15 milligrams, and that is PO daily at HS. Okay. All right, so I'm gonna verify that by looking at my orders that I have the correct drug, correct milligrams, correct route, how often, any other information. All right, so I have put this on my MAR now. So this is how you transcribe onto the MAR. So I'm not gonna continue with the rest of the drugs, but you would need to add your Lasix next, your Lipitor, and your potassium, and making sure those were all correct on here, okay? So make sure you do this before you come to checkoffs. This is super important because you need to be able to have your MAR ready to go for you to get meds. Another thing I want you to do is I have a drug book right here. You're getting an electronic drug book in your book bundle, so make sure you download it. It is this drug book. It's just electronic, so you can download it on your phone. I think it's called the
Davis Nursing Consult.
Yeah, the Davis Nursing Consult, and then the Davis Drug Guide will be in there. So it's super important that you know these drugs. So on your checkoff sheet, it actually has a medication form where it tells you generic trade name, drug class, dose, route, ordered, frequency, indication, adverse reaction, and nursing intervention. You probably need to look up each one of these drugs in your drug consult and have it written down. So for instance, we're going to be giving Lasix. So we're going to write down the generic and the trade name, the drug classifications, the dose, the route, all those things. What kind of things are you as a nurse going to be looking for? What kind of things do you need to know ahead of time? What reactions are there? Anything like that you need to have on hand available for you to refer to, because we're going to be asking you questions about each one of these drugs. And again, you don't know which patient you're getting, okay? All right. So now that we have that ready, we've looked up our drugs, we have our MAR and our orders completely ready to go. During our med administration, we usually have you do 3 checks. The first check is going to be when you're pulling out your medications. So you're going to be comparing the medications that you're pulling out of the machine to the medication machine and to your MAR. And then you're going to pull them off to the side before you go into your patient's room, and you're going to do another check. You're going to check those drugs against your MAR. And then the last check is when you go into your patient's room and you're identifying those drugs with your patient against your MAR as you're giving them to your patient. So just be aware of that. Another thing is, I'm not going to walk through this whole entire process. I'm going to pull a drug out so you can see what it looks like on your medication machine, and we'll go to the bedside, but I'm not going to pull all the drugs out because you are already LVNs and this should be just a review for you. All right, guys, so now we're standing in front of our medication dispensing machine. So I'm going to go ahead and make sure my hands are clean and wash them. Okay, if you look right here, you're going to have a log on. There are 2 log-ons. There is one for a witness and there is just a generic log-on. You're not witnessing anything, so you're just going to use the generic log-on. This is a touch screen, by the way, and it is case sensitive. All right, so once we've logged into our machine, it's going to ask you about training mode. It's always in training mode. Just hit OK. Now that we're in our machine, we're going to have a whole bunch of patients pop up. So I need to find my patient. So my patient is Adrian Andrews, and I can look right here and see Adrian Andrews. Now I'm on my patient's profile. I need to verify this by looking at my patient's name. And I can also look at their MR number, their date of birth, and their allergies. Okay, so now that I've done all that and verified all that, I am not going to pull all the drugs out. I'm just going to pull one to show you how to verify and everything. So we're just going to go with the Lasix or the furosemide, and it's 20 milligrams PO daily. So I'm going to get 1. Enter. Now that we've selected a drug, you're going to see over here, it's going to actually pop into this queue area where it's waiting. So you can actually pull multiple drugs at a time. And then we're going to press to retrieve. So we're getting our drug out. All right, so now that this is opening, it's going to tell me that I need to go to this first box right here. So right here. Okay, so I'm going to go right here. So now what I'm doing is I'm comparing it to my MAR. I need furosemide, Lasix, 20 milligrams, PO daily. So I've got my drug, it matches my MAR, I've got the right patient, I'm good. I'm closing my drawer. Now it's very important that we log off when we leave, so I'm logging off and making sure no one can get on my profile once I'm away from the medication machine. Once that's done, I am going to come off to the side and I'm going to reevaluate my medication. So that was our first check. Our second check is when you have all your pills. I may get me a pill cup. Right here. Have them in here. And I'm going to verify again. So again, I'm looking at my patient, looking at their name, looking at my drug, verifying that this is the correct drug that I have an order for and that it's on my MAR correctly. Okay, once that is done, we are ready to go to our patient's room. Now, when you go to your patient's room, you're gonna need your drugs, and you're also gonna need to take your MAR. Okay, so now that I'm in my patient's room, I'm again telling my patient what I'm doing. I'm washing my hands. Very important that you do your 2 identifiers. So I'm gonna look at their wristband and I'm gonna ask them their name and date of birth. I'm gonna do 2 identifiers and make sure this is the correct patient. I'm also looking at my MAR and making sure that I have the right MAR in the right room with the right patient. So I'm gonna tell my patient that I'm gonna be giving them their Lasix today, what their Lasix is for. If there was any assessment that I need to do before, I would be doing that. For instance, Lasix. Why don't you think about a few things you might want to know before giving Lasix? I'll give you a second. If you said blood pressure, you probably want to know your patient's blood pressure because we know that it's a loop diuretic and it's going to cause the patient to urinate and they're going to potentially lower their blood pressure. If you also said potassium, it is potassium wasting. So we want to know potassium level. We want our patient to have a good potassium level within a normal range. And we also want them to have an okay blood pressure, pretty good blood pressure. If they're really have a really low blood pressure, we may want to consider why we're giving this because that might mean that they're dehydrated. So just doing that assessment data. All right, so I've done all that. I'm going to make sure my patient knows what it's for and educate them on anything they need to know, like maybe this patient is going to have to get up a lot and go to the bathroom. Maybe I need to worry about safety concerns, fall risk concerns, all that kind of stuff we're going to address right now. All right, so my 3rd check now comes in where I'm taking my drug. I am comparing it against my MAR for the last time, making sure that it's the correct drug. All right, so I've done that. I've also identified my patient. So we're going to open up our pill, asking our patient if they want to take one at a time or they want to take them all, making sure we have water, all the things. All right, so we're going to give this to our patient, have them take their pill. We're also going to make sure that we document any medication that we gave on our MAR, anything that needs to be documented. Let's see here. I'm trying to think of anything else. I think that is it. If y'all have any questions, please let us know. I know we didn't go over the entire skill, but for our upper mobility students, we really felt like you just needed a brief overview because a lot of y'all give meds all the time. All right, thank y'all.